My name is Mary Thompson, and I'm both a nurse and a social worker by education and background. I received my bachelor's degree in nursing from Luther College in Decorah. Go Norse! And then I received my master's in social work at the University of Iowa about 10 years later. So I've been practicing in behavioral health for about 35 years and 25 or plus years in leadership. So this is really a wonderful outcome of that education and preparation. Then as a nurse, I love the creativity and the sensitivity that you get to deploy every day in interacting with patients. And then as I went on through my graduate degree, was able to impact patients in a different way. So I just really have always been interested in behavioral health. It's also a mission to me because this is a population that has traditionally been underserved. So I see my role in part, even when I was a clinician, as being an advocate for my patients. What I'm really excited about for this project is that we will increase access to behavioral health care for all the citizens of Iowa. I think our impact certainly will be in central Iowa, but we'll also have a statewide impact. In my 35 years, the one constant theme is the lack of available resources, and I'm just thrilled to be a part of the solution and to have such an impact in the region and also across the state.
My name is Sasha Khosravi. I'm a child psychiatrist. I'm also the chief medical officer at Clive Behavioral Health, and I've been involved with psychiatric care for approximately the last 15 to 16 years here in the Des Moines metro area. I chose behavioral health for a number of reasons. First off, I had always a curiosity about mental health. Even as a child, I grew up in a war zone. I was exposed to a lot of traumatic events, and for me, the curiosity at even a young age was how do people respond to adversity? How do they build resiliency? How does one bad event impact one person in such a different way than another? So as a child, I was always curious. I obviously didn't know that was psychiatry, but certainly it was something I was aware of. And in college, I actually worked at a residential center working with kids. Kids who had been labeled conduct disorder kids or bad kids. So the general label of these children with the destiny of maybe being in prison or juvenile detention written all over them. But where I really found out through my experience working as a residential counselor was there's so much more to their core, there's so much resiliency, there's so many different aspects of their lives deeply rooted inside of them that was impacting their behaviors and their psychiatric symptoms. So really understanding the amazing resiliency of these children despite their behaviors and getting to the root of why they were acting this way was really at the core foundation of why I'm in mental health. Seeing the amazing transformation, the great resiliency of our clients, seeing kids who are in distress, families who are in a state of chaos come in and reaching out for us for help and for us to build that foundation to really help them for a path of a better future is really rewarding for me as far as psychiatric care goes.
My name is Blake Schneider. I'm the Director of Social Work here at Clive Behavioral Health. I've been in social services for about 20 years and have worked with a variety of populations, including children, family, adults. Most notably, I worked in a forensic psychiatric hospital in Missouri doing dialectical behavior therapy. The most rewarding part of my work is seeing people take a degree of ownership, feeling a sense of power over their own life, coming from a time when perhaps they felt quite powerless. What excites me most about working at Clive Behavioral Health is to be a part of a team and a much greater mission to serve a population that has truly been underserved. We have the opportunity to provide early intervention and to prevent a lot of the suffering and the negative outcomes associated with the mental health conditions that so many of our clients experience.
My name is Dr. Eric Barlow, and I have been in adult psychiatry practice for a little over 17 years now in the Des Moines metro area. And I started out in independent practice with a couple of psychiatrists and then joined with a health system in town. And since 2014, I've been at a clinic called Compass Clinical Associates in Urbandale, serving folks with mental health disorders. The most rewarding part of my job is, and this has always been the case for me, is to see someone go from a state of hopelessness to a state of brightness, or at least a lighter place than they came from before. And when I started out in medicine, I actually started out in anesthesiology, which most people don't know. And after about 6 months of treating everybody like a case, I decided I needed to go to my second choice, which should have been my first, as different as they are, which is psychiatry. And that case became a client, and that relationship and seeing that evolve over the course of treatment and seeing that hope emerge was like watching a butterfly coming out of a cocoon in some places for these folks with such a state of hopelessness happening in their minds.
We are professionals collaborating together
We demonstrate humility, respect, and compassion for all.
toward a common goal of patient-focused care.
Accessible, equitable, and quality behavioral health care for all.